Hello and welcome. Today, we're diving deep into a very common ailment, pharyngitis, more commonly known as a sore throat. We'll explore what it is, what causes it, how it affects your body, and what you can do to feel better. Let's get started. So, what exactly causes a sore throat? Well, the most frequent culprit is viral infections. These are often the same viruses that cause the common cold or the flu. Think rhinovirus, adenovirus, or influenza. But bacterial infections, most notably Streptococcus pyogenes or strep throat, are also a significant cause. Less common causes include fungal infections, allergies, irritants like smoke or pollutants, and even certain underlying medical conditions. Now, let's talk about what happens inside your body when you get pharyngitis. Whether it's a virus or bacteria, the infection triggers an inflammatory response in the pharynx, which is the back of your throat. This inflammation causes swelling, redness, and pain, all those familiar sore throat symptoms. Your immune system kicks into high gear, sending white blood cells to fight off the infection, further contributing to the inflammation and discomfort. Pharyngitis is incredibly common, affecting people of all ages, races, and locations. Viral pharyngitis is particularly prevalent during cold and flu season, which typically spans from fall to winter. Strep throat is also common, especially among school-aged children. Factors like close contact with infected individuals, weakened immune systems, and exposure to irritants can increase your risk of developing pharyngitis. Okay, let's talk about what it feels like to have a sore throat. The most obvious symptom is, of course, pain in the throat, which can worsen when swallowing or talking. You might also experience a scratchy sensation, redness in the back of the throat, swollen tonsils sometimes with white patches or pus, fever, cough, runny nose, hoarseness, headache, body aches, and swollen lymph nodes in the neck. The specific symptoms can vary depending on the cause of the pharyngitis. Diagnosing pharyngitis usually involves a physical examination by a doctor. They'll look at your throat, check for swollen tonsils and lymph nodes, and ask about your symptoms. If strep throat is suspected, a rapid strep test or a throat culture may be performed. The rapid strep test provides results quickly, while the throat culture takes a bit longer but is more accurate. These tests help determine if the infection is caused by Streptococcus bacteria, which requires antibiotic treatment. While all pharyngitis presents with similar symptoms, it's primarily classified by its cause. Therefore, we can categorize it as viral pharyngitis, which is the most common, bacterial pharyngitis, primarily strep throat, and less commonly fungal pharyngitis or pharyngitis related to allergies or irritants. Distinguishing the cause is important for appropriate treatment. Fortunately, most cases of pharyngitis can be effectively managed. For viral infections, treatment focuses on relieving symptoms. This includes rest, drinking plenty of fluids, using throat lozenges or sprays, and taking over-the-counter pain relievers like acetaminophen or ibuprofen. Bacterial infections like strep throat require antibiotics, usually penicillin or amoxicillin. It's crucial to complete the entire course of antibiotics, even if you start feeling better, to ensure the infection is completely eradicated and prevent complications like rheumatic fever. While you can't always prevent pharyngitis, there are steps you can take to reduce your risk. Practice good hygiene, like frequent hand washing, especially after coughing or sneezing. Avoid sharing utensils or drinks with others. Avoid close contact with people who are sick. And if you smoke, quitting can help reduce throat irritation and inflammation. The prognosis for pharyngitis is generally excellent. Most cases of viral pharyngitis resolve on their own within a week or two. Strep throat typically improves within a few days of starting antibiotics. Ongoing research is focusing on developing more rapid and accurate diagnostic tests, as well as exploring novel antiviral therapies for viral pharyngitis. Scientists are also working to better understand the link between chronic inflammation in the throat and other health conditions.
That's all for today. Stay healthy.